Welcome to this video. My name is Pedro Rodrigues Ribeiro. I'm a psychologist from Portugal. One of the most controversial things about hypnosis, about the field of hypnosis, is the diversity of opinions of positions about the way that hypnosis works, or the theoretical background which can explain why and how hypnosis works. In past videos I call this the Hypnotic Wars, which we had a lot of sites dealing with efficacy, with explaining how hypnosis works and how hypnosis is created, etc. We have the state theories, the non-state theories, the research side, the clinical side, the traditional side, the Ericssonian side, well, a lot of sites. So it's not so you can see why hypnosis has such a difficult path, and sometimes a very bumpy path to enlightenment and to be utilized with a certain degree of reliability from clinicians and also physicians and other medical and health professionals. So how do we solve this issue? I have some thoughts which I want to share with you. These are my particular thoughts, which I thought about it and I understood from my years of practice and my years of study into different sides of hypnosis. So if you have a different point of view, please be free to share and we can discuss it. So from my understanding, we have a problem with a lot of definitions of hypnosis. We have a lot of scientific societies and scientific associations that were formed by specific people, by specific clinicians, by specific physicians, psychologists, psychiatrists, and they supported a specific view of hypnosis. For example, we have the American Society of Clinical Hypnosis, ASH, who was founded or co-founded, and one of the chairmen of ASH for a lot of years was Milton Erickson. And as you all know by now, Milton Erickson had a specific view of hypnosis, a view that was very unconscious derivative, not the unconscious from Freud, the Freudian perspective of the unconscious, but as a resource field that we all have on an understanding that we have a lot of learnings throughout the years. We have a lot of resources that are deep inside of us that not always we can access them, or we can only access them in specific situations. But if we have these resources, and if they can help us somehow So one of the most important objectives of hypnosis is to provide the communication with the unconscious, so those resources can be utilized in dealing with the specific issue. A lot of Ericssonians agree with the view of hypnosis as an altered state of consciousness and as a everyday trance. A lot of Ericssonians are prone to the idea of trance, which is contrary to the non-state, the social cognitive and cognitive behavior perspectives of hypnosis. But for example, the American Society of Clinical Hypnosis, ASH, was founded by Milton Erickson, and we can assume that that perspective is very enriched inside ASH. And we have other societies that were founded by social cognitive, by research clinicians, research therapists, research professionals who had a different perspective about hypnosis. So every society, every association has their specific view, their specific definition of hypnosis, based on their experiences and their training as professionals. So we have this side. Another issue is APAS, the American Psychological Association, Division 30. So if you don't know, Division 30 is the Society of Psychological Hypnosis. The American Psychological Association has a lot of divisions which are created with certain themes or certain areas inside the field of psychology. For example, you have the Society of Psychotherapy, the Society of Clinical Hypnosis, the Society of Educational Hypnosis, etc. You have a lot of divisions. If you have some curiosity about it, you can go to the APA website and you can view all the divisions that APA has. And the Division 30 is the division specific to hypnosis. Nowadays is called the Society of Psychological Hypnosis. One of the objectives of the Division 30 is to try to unify or try to achieve a consensus between all perspectives of hypnosis. If you go to the website of the Division 30, and if you do some research in past iterations of the Division 30 or the past past presidents, the past assemblies of the Division 30, you can find different definitions of hypnosis. Certainly, one of the goals of Division 30 is to try at its best to unify every corner of the hypnosis community and the hypnosis field. So you have certain aspects that the Ericksonians can agree on. You have certain aspects that the social cognitive theorists can agree on. However, in the pursuit of a unified definition, the Division 30 has made some controversial decisions and some controversial definitions of hypnosis. The last definition of hypnosis from the Division 30 has spawned a lot of criticisms from a lot of researchers and past presidents of the Division 30, like for example Irvin Kirsch and other researchers like Stephen Lin, Joseph Green, etc. So if you have a division who has spawned into give a controversial definition of hypnosis, it's not the right, or it's not the good way to try to unify all people. So you have these two great considerations. When you think about hypnosis, you think about two fields of application. The first field is the clinical side, the clinical setting, the clinical perspective of hypnosis. In the clinical setting, you have, for example, psychotherapy, medical hypnosis, pediatric hypnosis, rehabilitation, well, etc. You get the idea. The clinical aspect is the application of hypnosis into what hypnosis can do to help people, to help change, to help deal with symptoms, to help to deal with emotions, to thoughts, behaviors, etc. In a lot of medical and psychological professions. The other side of hypnosis is the experimental, the research side. Research in hypnosis was spawned by psychologists, by psychology, namely the behavior therapists. For example, the first great seminal work in hypnosis research was done by Clark Hall, a great psychologist, a great researcher, and a behavior therapist. So Clark Hall spawned the beginning of hypnosis, of the research into hypnosis. And when we do research in hypnosis, we are trying to investigate hypnotic suggestibility, hypnotizability, the efficacy of suggestions, of the relationship, specific protocols, hypnotic phenomena, etc. I'm saying etc. a lot this video, sorry. So, to do research, you have to be very mindful of the concepts that you are utilizing and defining these concepts. Not all the theories of hypnosis are suited to be defined in the clinical and experimental side of hypnosis, the research side. So you have to choose wisely the concepts and the correct definitions. You have to choose the problem, or choose your investigative question, the first step that you are taking into researching certain phenomena, or specific variables. You have to define what variables you want to investigate, do your research. And all these aspects are more suited to specific theories than others. It's not the question that one is better than the other. It's one is more suited for psychometric investigation, for research methodology than the other theory, namely the Ericksonian approach to hypnosis. Why is this important? Well, if you are a clinician, if your job is to utilize hypnosis in your clinical setting, you have a duty, ethical duty, to define and to utilize hypnosis as a good practice based on scientific research. For example, if you are a psychologist, you have a certain deontological code, an ethical code that you have to follow. Although hypnosis is not a legal profession, if you are a psychologist and if you are utilizing hypnosis, the utilization of hypnosis has to be inside your ethical code of conduct in psychology. And a lot of codes, I don't know everyone, but the Portuguese code that I'm well familiar says that psychologists have the duty to perform research-based, research-informed procedures. So, if you are utilizing hypnosis, you have to utilize specific aspects that are proven to be scientifically valid. The other thing is beliefs. Which beliefs that the patient or that the client has from what he or she understands that is hypnosis, or the myths. As a professional, you have the duty to clarify some of these myths and some of these aspects, some of these beliefs. For example, it is highly highly ethical doubtful to provide past life regression sessions if you are a licensed psychologist or a licensed physician or licensed whatever, because you have to engage with research-based interventions. And nowadays, research hasn't proven yet that past lives exist, or that past life regression therapy is a valuable tool. So you have to be very careful of which interventions you do. That's one aspect. The other aspect is, if you want to do hypnosis research, you have to utilize variables, definitions, and methodologies that are suited to research. Probably you have to utilize more social cognitive or cognitive behavior perspectives on hypnosis because they are more suited for research. If not, you have to develop to create a new methodology, a new form of doing research, a valid form, which can be inserted in the scientific method of research. So these are some of the aspects on defining hypnosis and to utilize correctly hypnosis in the two main fields, the clinical side and the experimental side. Thank you for your time and thank you for being in that side. I hope that you are doing well and safe and healthy, and I'll see you in the next video.